tonight we're going to talk about bowel and bladder control primarily. So Dr. Graves and I both actually trained together at the University of Pennsylvania in Philadelphia, and we've been each practicing for close to 10 years, and we've had 5 years of urology training in residency and med school before that. And the topic tonight is something that we do have a lot of focus in and enjoy taking care of and have specialty in.
So then that goes on to the next step. Well, what if I have all these problems? What if I have overactive bladder frequency, urgency, racing to the bathroom, leakage of stool, and I don't want to take a pill, or I've tried the pills and they have too many side effects? Well, there's essentially three main topics that we'll touch on here. There's the Medtronic Inner Stim system, the Medtronic Neuro, which is a tibial nerve stimulator, which I'll go over, and then injectable medications. It's important to note that the Medtronic Inner Stim neuromodulation system, which is what we're discussing tonight, mostly is the only one that really helps with control of the bladder and the bowel. So Botox is an FDA-approved medication to treat overactive bladder frequency and urgency. It does not, however, treat fecal incontinence. And it's actually a procedure that's done sometimes in the office, but oftentimes in a surgery center with a little bit of sedation. Sometimes a general anesthetic is needed. And essentially Botox is injected into the muscle of the bladder to relax the bladder to prevent the overactive bladder. And it really does work. However, it wears off by the nature of it. Essentially, it's a toxin, and that effect of it wears off, similar to the Botox that some people get in their foreheads, for example. It doesn't last forever. And so that's one of the downsides of it, is that you have to redo it 6 to 12 months, often gets repeated. And in addition to that, there are side effects that can kind of paralyze the bladder temporarily and require the need to catheterize. And it also has been linked to causing some urinary tract infections after the procedure. So for that reason, up to 50% or so of patients will come off of that after a treatment or two, but it's not harmful to try it. However, I think that if you have an option that can last for many, many years and it's one procedure, I think that's where the Medtronic systems sort of beats out Botox. Some patients might be just a little reluctant to have the Medtronic Inner Stim system implanted. And so sometimes patients will want to try the PTNM, the Percutaneous Tibial Nerve Stimulator neuromodulation. And that's a great option. We do it in the office. You come in, takes about 30 minutes to get comfortable in the chair. And there's essentially like an acupuncture needle that stimulates the tibial nerve, which actually tracks up and then modulates the bladder. So during that 30-minute session, it's in the office. It's once a week for 12 weeks, and after that, they're monthly maintenance sessions for long-term relief of the symptoms, and it does work. It's amazing. And then lastly, the Sacral Neuromodulation Medtronic system. So there are two different types of systems. There's the rechargeable and non-rechargeable, and that'll always be a question of, well, which is better? Which should I use? They're both essentially put in the exact same way. The only difference is one of them you have to recharge, and one of them you don't. In terms of the battery, it used to be that the rechargeable battery was used more. It's a little smaller and it lasts longer, but they've recently come out with an Inner Stim X, which is very new to be released. And that non-rechargeable battery is lasting for anywhere from 10 to even 15 years, which is amazing because essentially Medtronic started off as a battery company, and that's what they're good at, and that's what they do. And to have a battery that can not have to be recharged for 10 to 15 years, that's pretty amazing. So this system essentially is implanted under the skin and the upper buttock, and the lead goes and stimulates the sacral nerve. But before we go and implanting it, we want to make sure it works. So what a lot of people what everyone essentially does is they have an Inner Stim test. And that's one of the things I love about Inner Stim, is because if you're not sure, you just do the test. And the test is done either in a surgery center or even just in the doctor's office. We actually do that in our office here. So you don't need to be put to sleep. There's an x-ray machine that comes in, and we actually do the procedure right here in the office, in the comfort of the office, and not have to go to a hospital or anything like that. And once the lead is put in the right spot, you wear an external device that is on for about 3 to 5 days. And you can see what it will be like if you were to have the InnerStim implant. And so you can actually see what your symptoms are like, and we monitor to make sure there's a greater than 50% improvement in your symptoms. And if in fact you do notice a difference, then we can go ahead and schedule you for the implant, which essentially is very similar to the test. It's just that we implant the battery under the skin so that you can keep it in, and it's permanent, and it lasts for 10 to 15 years. And then we have to change a battery, which is very easy to do in the future if needed.